Rich Roth, Dennis Carter, and we are joined live in studio by Josh Bailey of Rehab Associates. Got a lot to talk about with you, Josh. Welcome to the show.
Thank you for having me.
Glad to have you. Glad to have you. We've got crazy stuff going on. I mean, obviously, you look around sports and tons of injuries in the NFL. I'm just going to throw this at you right off the bat. How much of this do you think is related to COVID and the fact that these teams didn't have the normal preseason and preparation and all that? Is that a factor, or is that being overblown?
No, I think it has to be a factor. I mean, these obviously professional athletes are training year-round anyway, but you can't simulate impact. And that co-contraction of your muscles that has to happen right at the time of impact, you only get that when somebody else is hitting you. And when you don't have that, those microseconds before your muscles turn on to protect your joints, you can get injured in a quick minute. And I heard you talking about Juan Thornhill, and I think Juan had that injury that every player wants to avoid.
Right.
But having there's very good evidence that the faster your thigh muscles turn on, the front and back of your thigh, the less likely you are to have that type of injury. And so being able to train that, and we train people on that every day, even people that have had total knee replacements, we're training them to respond in the same way.
Josh, I'm used to seeing you on Friday nights on the sidelines for high school football. Does it feel weird for you not to be doing that on Friday nights at this time of year? Oh,
of course it does. It's I don't even know what to think about February for high school football, other than cold. But it's been so long. I mean, it seems like my whole life. It's been Friday Night Lights, and we employ athletic trainers that work on the sidelines with our local school-employed athletic trainers, and so we're used to being on the sidelines supporting them, and I hate not being there. So I guess we're going to open it up with basketball season this year, though. So
again, how weird is that? But the fact that we are going to get all 3 seasons, because I know at one point that was kind of in jeopardy, and they were looking at maybe eliminating fall except moving football, and and that would have been lousy for the kids who played those sports. So I guess doing the best we can.
I do feel really sorry for the athletic trainers when spring season comes. It's going to be a ton of sports going all at one time and overlap, and I don't know how they're going to do it. So if you're an athletic trainer, we're going to help you as best we can. So.
Talk a little bit more about what you guys do, because again, we know the rehab story. We'll hear a little bit more of that from Rehab Associates. But as far as you being involved in the community and working with the different high schools, you said you had 14 locations. You have a ton of resources as far as people to go out. What do you guys do exactly with all the high schools?
So we're on the sidelines for I think 13 high schools and 2 colleges every week during football season. Wow. And sometimes we'll have 2 or 3 people at a single game, depending on what athletes we're rehabbing. Because if a particular therapist is working with an athlete who's just returning to sport, oftentimes the therapist is there just to help the athletic trainer. We're super blessed. Almost every school in this area has an athletic trainer, and that's it's necessary. Mm-hmm. But for years, it wasn't that common. And the sports medicine coverage is fantastic. And having an ability to, one, see the accident happen, that helps us to rehab faster, but also have the relationship with the students and the athletes and the coaches and the athletic trainers and local physicians. The process just works smoother. If you just tore your ACL or even if you have a thigh bruise, you don't really want somebody poking on you. Right. And you don't feel good about it. And if you have a good relationship, you're much, much more comfortable. And the key in a lot from recovery is timing of service. In controlling cost is timing of service. So there's a lot of reasons why we want to be immediately available to those athletes and get them back. And that's what every coach wants. Like, are we, the famous coach quote is, are we doing everything we can do? They don't always,
we're not.
They don't always know what's supposed to happen. I mean, most of the time they do, but sometimes they don't. And especially college coaches, the most common question I get is, are we doing everything? Like, yes, sir, we are. I promise.
Do you ever look at him and just be like, what do you think?
Yeah.
Come on.
Yeah, we're taking a lot of coffee breaks. No, we're not. We were working hard, especially during COVID. I mean, we were working harder than ever, to just get people back to doing their normal things, even injuries from cutting grass or raking leaves or, the honeydew list. It got too big. We're still going to treat those people like athletes as well. Everybody wants to get better faster.
On the high school and college football fields, what are the worst injuries that you fear the most when you see them out on the field? What's the one that you don't want to see that kind of turns your stomach?
Yeah, the big one is cervical injuries. Young kids, they're taught good techniques, but tackling helmet down, those scare me. And I'll be honest, when and the athletic trainers I work with will vouch for this. When I see that and it's in front of me, I'm screaming for the athletic trainer to come help me because I'm nervous about it. And there's so many. We saw a couple Louisville last week, and also the Virginia Tech game. Yeah. Those are just scary, scary injuries, and you have to do everything right. And thankfully, the athletic trainers have great skills in doing that, and we usually are just extra hands during that. So I am super fearful of that. Another thing I would comment on is I hate to see a knee injury where the athlete stands up, takes a step, and then lays down.
Yeah.
My brain goes to ACL. They stand up and their knee shifts.
Okay,
and they feel it shift, and they know there's something bad wrong, so they lay right back down.
Okay, so it's not really a problem that they did it. It's when you see that happen, you realize that it's something serious.
At least it has a bigger potential to be a more serious ligament injury versus like I just got twisted up. Mm-hmm. And young athletes all the time will tell us it popped. We hear that a lot, and so we have to kind of break down what actually occurred and determine what we're going to test and what's an emergency and what we can treat on the sidelines. And again, we're doing all this in conjunction with the athletic trainers. I always tell every athletic trainer I work with, it's your field. I'm there to help you, mm-hmm. and we have great working relationships. I've been on Brookville sidelines for 13 or 14 years in a row.
Long time.
And it was Rustburg before that, and then Alta Vista before that. I mean, so it's years and years of doing this, and so it's great to be able to get those relationships. And as I mentioned earlier, seeing it happen makes such a difference in your clinical diagnostic skill because we saw the impact. And, so we're not out there goofing around on the sidelines. We're watching the play because that matters so much. And thankfully, most of us just really like sports. So that helps.
Josh Bailey joining us here in studio with Rehab Associates, rather. 14 locations. You touched on COVID. That's obviously been a huge impact for you guys. Was it just people scared to come in and really be helped and just worried about the whole environment, or is it folks just not wanting to go out at all, or what was kind of the issue there?
Sure, it was kind of twofold. The first one was early on when the surgeries were shut down. That was big because although we treat a lot of injuries conservatively, we still have a lot of patients who have surgery, knee, neck, shoulder, wrist, foot and ankle. We see a lot of those type things, and those just didn't happen for a couple of months. So that was huge. But then there were people that either couldn't go to the doctor or were afraid to go to the doctor, whether it be us or their family practice doctor or whomever. I think they needed to see us going above and beyond. We joke about it all the time. We're cleaning surfaces that are clean. We've already cleaned them, but everybody wants to see it get cleaned.
Right.
And we're going through a ton of cleaning stuff just to make people feel good and know that we're taking care of business. And we look scary as it is because it's a mask on. We joke like you can't see our smile behind the mask, but we're still happy to see everybody. But I think those are the two biggest overall impacts.
Rich said he wanted to ask you about old guy injuries, and he's not as old as I am, so I'll be the expert on
Thanks,
the old guy
DC.
injuries. What are the injuries that you see the most from, say, guys in their 50s, 60s, things that you guys have to deal with a lot?
Probably three things stand out. Shoulder injuries. Doing the stuff you've always done, reaching back like Brian here did earlier, changing a light bulb, and your shoulder hurts, and you don't know if it's a small thing or a big thing. So that shoulders are big. Back pain, and sometimes it's from like putting on your socks, where when we were all young, we didn't think anything about those things, but as you get older, the little things get a little harder. And then like surgically related, the weekend warrior, Achilles tendon ruptures. Those are, and I probably pay more attention to that than most because my specialty is foot and ankle. But so I see a lot of that. But those are devastating. Those are it takes you a year to get back to where you used to be, and that's with a good surgeon and a lot of rehab and a lot of discipline.
Lynchburg is a big running community, isn't it?
It is. Yeah.
What's the one thing that you see most, and then the one thing that folks can prevent or do to help prevent? Because obviously you're not going to be able to prevent everything, but I mean, is it just stretching? What is it? I mean, what do you see with runners?
I think the thing that no runner likes to do, but every runner needs to do, is a dynamic warm up. And then stretching when they're warm at the end. And the stretching really needs to occur 15 minutes after you stop running. And nobody wants to do that.
Yeah.
And I get it. It's terrible, but it really does improve longevity. The other thing that I see when runners is they run a lot of miles, so they go, my legs are strong. But that's an endurance type of strength that's different than power production. So a lot of runners don't strength train their legs, and they should. And we try to help them do that in a functional pattern. So it's not necessarily lifting weights per se, but it's using your muscles in the right way. If you've been running for 20 years, I can almost assure you that there's patterned weakness, and it shows up differently in men and women. Women show up with hip issues, and men show up with lower calf issues more commonly.
I bet you see a lot of, in your profession, or hear about a lot of rotator cuff.
Oh, yeah.
Things that have to be taken care of. I know I had rotator cuff surgery, 12 years ago or so, and now my other shoulder is kind of acting up a little bit. And I hear that's not so uncommon to have a problem with one shoulder, have it operated on, and sometimes the other shoulder will come back and bite you.
Yeah, I mean,
years later.
Sometimes it's just the anatomy of your shoulders, and the end of the shoulder blade, called the acromion. Some people's are just built with more of a hook to it. And so when you raise your arm overhead, it creates compression between your humerus, the upper bone in your arm, and your shoulder blade. And so it just pinches everything in between. Unfortunately, the things in between, some of those things are tendons. And I describe it to patients as kind of like hitting a steak with a hammer. If you hit it enough times, you'll eventually put a hole in it, and that's a rotator cuff tear. And the great thing, the good news about rotator cuff tears is there's very good data that show about 85% don't have to have surgery. They can rehab and recover. And it's because you have 5 tendons that loop all together, so you can substitute very well. And people have great range of motion, great power, but have a torn tendon. And probably, if truth be known, all of us probably have a little bit of trauma, just from years of doing that. So it's not uncommon at all to see one shoulder and then the other shoulder happen when, you still got the same anatomy on both sides.
Yep.
Josh Bally with Rehab Associates joining us here in studio. RACVA.com for more information. Tell us a little bit about telehealth. That seems like one of the things that before COVID was kind of coming on, and a lot of practices may be forced into it. But Could that be one of the, and I dare I say, good things that comes out of COVID? Because the opportunity to see people where, we get rid of the waiting room and different things like that, but you can still help them, via telehealth. Is that something that's really going to help in the long run?
I think it will. I think people are still a little bit afraid of technology, but we're trying to make it as easy as possible. Where when we set you up for a telehealth appointment, it sends you a text reminder when your appointment time is, and you're in a virtual waiting room, and it also triggers our therapist to know that when the patient is prepared, and then it's just click a link, and as long as you have an internet connection, we can see you and you can see us. I think that could be a long-term benefit. We used it some for out-of-town patients. We have a lot of for our foot and ankle clinic out on Timberlake Road. We see patients from literally all over the world. And so in some of those cases, there were certain insurances that allowed us to cross state lines and some that didn't. So we were able to help those people. And sometimes it was just, free care. Now, there's a lot of insurances that don't require any cost sharing, so no copay or co-insurance if you receive telehealth services.
Oh, wow.
I don't think that's going to stay forever. but for now, I think people recognize it hasn't always been safe to go get the care that you need. So this is one way we can assure that no one is exposed to anything because you're in your own home.
You've obviously seen some great athletes come through the ranks. If you've been on the sidelines, say at Brookville and other schools, did you get to see Logan Thomas in high school?
Yeah. Well, I didn't have to treat him much. I got to watch him a lot. Logan's tough. And, I often would joke, that Brookville would be up by 40 or 50 and, it's 3 minutes left in the game and Logan's under center. And, I'm like, why is he under center? And it's because Logan's a competitor and, he wanted to play. I have gotten to see a lot of great athletes, locally and otherwise. And it's just amazing the people that at that caliber, that other gear that they have that I always wished for.
We all wish for. Yeah.
No kidding. No kidding. Josh, thank you. Anything else folks need to know about Rehab Associates right now?
The only thing I would comment on is please don't wait on an injury. If you are hurt, give us a call. We have direct access for almost all insurances. You can call us. We can find the best therapist, the best location, the best time slot. We try to really make it convenient so it's quick and easy for you. So thank you for having me.
Oh, it was a pleasure. And we need to stay in touch because with all the stuff going on and all our aches and pains. I love that he said earlier, mowing the lawn.
Yeah.
Hey, we see
that can be tough.
Well, okay, craziest injury you've seen where you're sitting there going, how did you hurt yourself doing that?
Sneeze.
Real back?
No, torn rotator cuff.
Really?
Wow.
From a sneeze. Yep.
Wow.
Yeah, I've seen some crazy ones, like that were just bad ideas. Like, I'm pretty sure we all knew that wasn't going to work out when you did it, but
All right, we got to hear one of those, right?
So I had a relatively young guy who was actually in physical therapy school at the time, was trying to impress a young lady, and so he was going to show her how he could jump down 2 flights of stairs at one time. And he did. The landing was somewhat problematic, and he actually produced a very, very severe, it's called a pylon fracture, which is where one bone in the ankle drives up into the other bone and splinters it.
Oh.
And it is a really, really devastating injury. And so, I'm seeing this nasty injury. He's got pins and screws everywhere in his ankle. I'm like, how did this happen? And he's like, well, and he was very honest about how it happened. But I was like, did we learn any lessons here?
Boy, I hope he learned a lesson.
I think he married her. So
How
that's
about
the
that?
upside.
Okay,
they were at least engaged when I last talked to him. So
That's because she felt bad for him.
Maybe, but hey, guys, you got to do what you got to do.
Like, this guy needs help. He needs guidance.
I tell you what, he went the distance to impress her, though. And obviously he did if they hooked up.
Yeah. So
Wow.
each his own.
That's quite a story. Quite a story. And a sneeze of all things. Go figure. Josh, thank you, man.
Thank you.
Thanks,
Appreciate
Josh.
you guys having me.
Josh,
See you on the sidelines.
I hope so. Sooner than later.
Yeah.
February.
February, March, April. High school football in April. Get ready
right.
for it. Yeah.
It'll be here before you know it.
Yes,
DC.
it will.
Yes, it will.